need some help. I'm not feeling very well.
What's wrong? I
just feel a little nauseous. There's some pressure in my chest.
Okay. Let me just take a seat here. Roger. Oh. Roger, wake up. Roger.
Hello there, Dr. Brownhilda Santo. Today we get an exciting topic for talk about CPR, Cardiopulmonary Resuscitation. And it be very important, say, make we pay attention because this technique we will go learn on today if he save a life. May we start by saying what happens when your heart stops. See, when your heart the pump, you pump blood to the rest of the body, to the brain, to the rest of the other organs then. And but when your heart stops, you see and say that blood is stopped for go for your brain and to the rest of the other body, other parts for your body. And within 4 minutes of no blood supply to the rest of your body, especially your brain, it start cause some brain injury. And within 10 minutes of no supply, it cause irreversible brain damage. So CPR and chest compression, it help we for assist that heart way, the pump again, for pump blood to the rest of the body, and technique they for do one. So you go put your hand over the chest, and the purpose for doing this or the whole objective is to press on that chest bone for press enough for get to the heart and put enough pressure to the heart so that the blood will be pumped and circulated to the rest of the body. And you see how the blood is now pumped to the brain and the rest of the body with the compression. But technique they for do one. You get for push about 2 inches, which is about 5 centimeters deep, and you also get for push 100 to 120 times per minute in order to get good circulation. So 2 inches, which is 5 to 6 centimeters deep, and also 100 to 120 compressions per minute. If you interrupt them, if you stop for push, you go see and say blood go stop for the circulate. And so it be very important, say, make you minimize interruption less than 10 seconds when you the one give breath to the patient or when you the exchange with another person for do CPR or chest compression. Minimize the compression. If you no press hard enough or fast enough, you see and say blood no go to circulate. If you no press deep enough, blood no go be able to circulate to the rest of the body. And if you press too fast, the heart no go get enough time for refill and for blood for circulate. So you get for do them very well. Next, we go see how for actually do the CPR, and we go start for children to adults. So you make sure say the area be safe, and then if the person that they do it look like say it don't collapse, you try to call the name. If you need the answer, you look for help. If people then there around you talk, may they call ambulance or may they call for more help. And then now you come back to the patient, you look, see if it be say it chest the rise, if any signs of breathing, put your ear, your chin around ear for see if you go feel any breath. And if you know they feel anything and the person no get pulse, then you go start CPR. You go put your one hand on top of your palm on top of the mid chest between the umbilicus and the rib cage, and then you put the other one over that, and then you start now compressions, counting 30 compression.
2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After that, now you go give the person 2 breaths. You go use one hand, you push your forehead down, use the other hand, tilt the chin up, take your mouth, put them over your mouth, give it 2 breaths, and after you give the 2 breaths really fast and minimize interruption for CPR, and then go back, do chest compression for 30 again, and then come back, do breaths, and do and so until help arrives or until the person shows signs of life. We go now see how to do CPR now for infant. So for infant, it go be similar. Make sure say the area be safe. You tap your leg, feet, see if you be say the talk. It respond to you or cry. You call for help. Look the infant. Make sure say see if it chest the rise, your abdomen the move, and if you need do so, then you now get ready for start CPR. And this time you go start chest compression. You go use a little bit different technique. instead of using your palm like you go do them for children and adults, you go use 2 fingers them, and you put them between the umbilicus and the rib cage, and then you start count to 30, just like you do for adults too. And
2 and 3 and 4 and 5 and 6 and 7 and 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
after you do and so now you now give a breath, and the way you go give breath, you go tilt the head down, lift the chin up, use your mouth now, cover both, give the breath over the bikini in mouth and in nose, unlike for children and adults when are over their mouth. This one you go cover the mouth and the nose because say the infant gets smaller face, and then you go repeat now the CPR, and you repeat the process again, 30 compressions, 2 breath until the pikin start to cry or help arrive. Okay, now we don't see how to do that CPR. Now for check that pulse for children and adults, you go put your finger for this Adam apple, and then you just slide on 2 breath, a finger breath laterally to that. You go feel the pulse. For infant, you go feel your own pulse now around this area you do and so. So I hope say this video it go help una share them, and we go talk about more other techniques for help people them in crisis. Knowledge is power. Thank you.